Senator Tim Scott.
Thank you. Good morning, Chairwoman, and thank you for all your hard work and dedication on so many of these issues that are important to the nation. Frankly, you have been the leading voice in our Congress, and I mean, either the House or the Senate, so in our Congress, for issues around disparity and around taking care of people who simply need help. You have been the type of chair who looks only at Americans, not at parties, not at color, but at people in need. So thank you for being that kind of chairman. And I really appreciate your leadership. So let me just say this, as we looked at the numbers, in South Carolina, 27% of the population happens to be Black, about 43% of the fatalities are African-American, 32% of the diagnoses are. And so those numbers were alarming to me initially. And as I looked around the country, I found that 14% of Michiganders are African-American, but 41% of the mortality were Black. So I started realizing that there seems to be a racial impact, and I asked HHS to step up and start giving us more information broken down by racial categories, and they did that. And I asked my governor to do the same thing, and he did that. So we were able to then start targeting more of our energy and our focus on these healthcare outcomes and disparities, number one. Number two, as I spoke with NIH and Dr. Collins, he started talking about the importance of programs like the RAD-X up so we can put more resources, more testing in communities. Frankly, I pushed my governor and our healthcare apparatus in South Carolina. I'm so thankful that they responded so constructively and positively, that we've had pop-up sites for testing at churches and at schools in minority communities. These are really important. One of the things that I see as headwinds is that even with all of the new ground that we're making up, and there's a whole lot of ground to make up, that when you look at the confidence within our communities, particularly the communities of color, as it relates to taking a vaccine, 25% of African Americans say they're willing to take the vaccine, 37% of Hispanics. To the panel, what can we do to increase those numbers?
I would like to take a stab at that, Senator.
Thank you, Mr. Jones.
Again, the issue has to do with trust, and you don't start trust during a pandemic. The trust starts way before then. And I need to give a shout out to FQHCs. That's who we are. That's what we do. We're in the communities. People trust us. People come see us. They're treated with dignity and respect. It doesn't matter if they have insurance or if they don't have insurance. So the way we can do that is identify agencies, organizations, and churches that people trust. Once you get the trust, then you can start the conversation of convincing people the value of getting the things that they need to have.
Thank you, Ms. Jones.
I'd like to follow with that. This is Dr. Carnathon. We right now are working with through a cross NIH initiative led by NHLBI as well as NIMHD, Minority Health and Health Disparities, because we understand, certainly as Dr. Jones has stated, it would have been ideal to start sooner. However, we have to start now. And we have to get out there. We've got to build these bridges. And I think what's going to be critical is to communicate the urgency and also to really empower community members to understand that they have to be the ones to step up to help us stop the impact that we're having on minority communities. And so what I'd really like to do with our messaging is really promote this partnership that we have to step up in order to help ourselves.
Well, Doctor, let me just make this comment before I hear from another panelist. On the Paycheck Protection Program, one of the things I saw as a small business owner, or at least a previous small business owner, was the importance of having a marketing mechanism in place. So I went to the Minority Business Development Agency, the MBDA, and said, okay, I'm going to put $10 million in the MBDA so that we have the type of marketing that reaches in specifically into communities of color and targets the outcomes that we're looking for, which was higher utilization of the PPP. What I hear is I would say that I hear that the need for something similar, and if that is true, where is that similar organization? Certainly the churches. I know the HBCUs. I've worked with them. Frankly, our office led the charge to get more resources for the HBCU in the CARES Act, and frankly, according to the UNCF, we have record-breaking dollars coming in. during the last 3 years. So how do we find those one or two organizations that penetrate so deeply that we can have that kind of focus?
Yeah. And Senator, this is Gene Woods. One thing I think we just got to recognize that part of the issue is after 3 million cases of COVID and 140,000 deaths, we still have a fundamental, just a general in the country, 50% of people still don't want to get vaccinated. If you look at even doing flu season, last flu season, we had 40% of the population that said, we're not going to get a flu shot. So I think the messaging has to occur on multiple levels. There should be a national strategy right now, a PR campaign, as you mentioned, that touts the benefits of vaccination. I think that's layer one. And then with respect to your suggestion, what we've done here and in the communities we serve is we have partnered with media outlets that specifically focus on minority communities. So I think there could be a national strategy, but there has to be a local strategy as well, because the different media outlets have different insights and into the particular community. So I think it's got to be a multifactorial type of campaign, but that begins that vaccinations are important as part of containing COVID, but also influenza.
Mr. Woods, I'd love to talk to you after this is over. If you have time one day this week, I'd love to continue this conversation. Yes, sir.
Senator, if I could say one thing quickly, I think we have to stop funding the usual suspects all the time. We have to look for new organizations that have deep tentacles within the community. And that's the initiative we're doing now. There are organizations who the community respect as leaders. I think we have to partner with those organizations, as we've said earlier, and make sure some of the resources empower those organizations to do the work and be the lead for that work within the community.
Thank you, sir. And I look forward to reaching out to some of the panelists if you all are interested in engaging in this conversation further when we're not limited to 5 minutes of questions and answers. I've read through your backgrounds and frankly, an incredibly impressive group of folks who are dedicating a lot of your life to making a difference. I would love to just partner with those who may be interested in doing so. Thank you.